You should be familiar with what we're going to go over today due to your reading and your discussion assignments from last weekend. First, some terms. A neoplasm, or tumor, is a new growth that serves no useful purpose. The growth is uncontrollable and progressive. A benign tumor is something that is localized or grows in one location. It is rarely fatal, and usually the body's self-defense or immune system has encapsulated it. On the other hand, a malignant tumor is invasive. It grows rapidly and can spread. When cancer metastasizes, this is where the cells move from one place to another through the blood or lymph systems. Here's an image that depicts what a cancer cell could look like when found in tissue. It's surrounded by normal cells. The tumor forms due to discrepancies in the generation signals. Due to genetic, environmental, chemical exposures, normal cell growth and death is turned off or altered, creating this tumor. Take the time to pause me if you are watching this lecture and locate the video using the link here and or on Talent. It is a visual of how the tumor is created and also how it can metastasize. Pop quiz. Which terms refer to a neoplasm whose cells have moved from one place to another? Metastases. Alright, cancer doesn't usually pop up out of nowhere. Generally, there's a progressive evolution of cancer cells. Here are the different stages. Start with hyperplasia. Hyperplasia, hyper being the medical prefix for a lot or quick. Here it designates excessive growth of cells. Dysplasia, or dys, being the prefix for abnormal, describes an abnormal growth of cells. And then there's carcinoma in situ. It is a cancerous growth that remains in place or localized. Carcinomas that metastasize spread through the circulatory system and can spread cancer to other areas or organs of the body. The etiology, or cause, of cancer is quite broad. It is involved with high complex alterations in a cell's DNA. This image here depicts several environmental exposure causes we have linked to being carcinogenic or cancer-causing. The scale here used goes from non-ionizing to ionizing frequencies. You do not need to know what causes those frequencies. It's just here for a visual tool. So other causes of cancer are associated with a person's age or genetics. For example, breast cancer and abnormal BRCA1 and BRCA2 genes have been linked genetically. A person's compromised immune system also puts a patient at risk for cancer. That includes someone who has received an organ transplant, has AIDS or HIV. A big contributor to cancer can be preventable, and that is a person's body weight and diet, as well as recreational choices like the consumption of alcohol at abusive levels or smoking. There are several persuasive journal articles out there stating the links between weight and cancer. Cancer cells love adipose tissue, or more so the hormone connections to fat cells. The more that there are of them, the higher risk category a person could be in for being overweight. Etiology continued. A person's level of exercise and physical activity or lack thereof can contribute to cancer cells, or to some cancers. The environment again, but this time I'm not talking about the sun ionizing frequencies. I'm talking about environmental chemical exposures. An example here would be asbestos and how it causes a type of cancer known as mesothelioma, which is a lung cancer. Put me on pause again and take the time to follow this link to learn something very interesting about asbestos. Asbestos is still a threat today, as are several other chemical exposures out there. Most recently in the news, there have been reports of some pesticides and lawn treatments showing patterns across the country contributing to cancer. Viruses are not innocent in the cancer fight either. Liver cancer arises from hepatitis B and C viral infections. There's bacteria too, like Helicobacter pylori, that has been known to cause stomach cancers and ulcers. Parasitic infections of Schistosoma hematobium cause bladder cancers. So many causes to cancers. How is anyone safe out there? Moderation and education are key. So is early detection. Medical advancements in early laboratory detection have helped pinpoint cancer-causing elements as well as to treat those patients less fortunate. There have also been great strides taken to finding patterns in cancer cases that used to be considered an anomaly by researching the DNA of tumors. When it comes to pesticides, for example, used all over the nation. Scientists and laboratorians that can work to find relatable causes can be part of a movement eradicating that source, thus helping future generations to not be plagued with that environmental cause. Here's some more terms. Learning these terms will help you classify some cancers. We'll start with carcinoma. This depicts a solid tumor of epithelial tissue. An example, adenocarcinoma. It is a malignant tumor of a gland. Sarcoma is a tumor of connective and supportive tissue such as bone, fat, muscle, and cartilage. An example here would be osteosarcoma. Osteo being the medical prefix for bone means this is a malignant tumor of bone. Cancers of blood and lymph have their differences. We mentioned earlier in this semester that anemia is your link to blood, so cancer in the blood is also known as leukemia. An example of cancer in a lymph system would be Hodgkin's disease or non-Hodgkin lymphoma. Signs and symptoms of cancer. Unexplained weight loss, say 10 or more pounds in every short period of time. 10 pounds in a year, nothing noteworthy. Take that personally. 10 pounds in a week, red flag. Severe fatigue that does not improve with rest. Unexplained pain. Remember, if the pain is acute, it could be the body trying to warn the patient. Changes in skin or wart, mole could be a sign of skin cancer or something that may be lying deeper. Bowel or bladder changes can tell a patient a lot, since the patient will know what is their normal and what is not. Sores that do not heal can also be a red flag that needs investigating. Signs and symptoms continued. White patches in the mouth or on the tongue, known as leukoplakia. These are seen largely in patients that smoke or have other tobacco use. Other signs, there can be unusual bleeding or discharge, thickening or lump found in breast tissue or on other places of the body. Indigestion or difficulty swallowing can be a sign as well, along with nagging cough or hoarseness. At a first sign of something awry, a patient should bring it up to their care team. If you noticed with the signs and symptoms, most were very local to a particular region or system of the body. Like I mentioned before, early detection is the best treatment plan for cancer. Being alert to the problem soon could prevent metastasizing of the malignancy. So how is cancer diagnosed? This is where we come in and help the care team of doctors and specialists come to an answer. Biopsies are very common with cancer. This gives pathologists an opportunity to look at the cells and see if anything looks abnormal. Some biopsies or lump removal can identify a clear border of normal cells around the unhealthy ones. This is called margins clear. Testing on the removed tissue can still be done, but potentially the entire carcinogenic tissue could have been removed early enough to prevent further surgical interventions. Another form of diagnosing cancer that is highly effective is known as the Pap smear, aka Papa-Nicolau test. That's a reason why we call it just a Pap smear. This is named after the physician who coined this process. The Pap smear is used for early detection of cancer in the cervix, uterus issues, and also HPV. Blood analysis can be used to count and mark abnormal blood cells as well that could be indicative of certain blood cancers like leukemias. Other blood, urine, or tissue tests can look for tumor markers. An example of a tumor marker would be the CEA test or the carcinoembryonic antigen test. This test aids in the diagnosis of treatment of colon, stomach, pancreas, lung, and breast cancer. The PSA test, or prostate-specific antigen test, helps detect and monitor cancer in what? Well, you guessed it, the prostate, hence the name of the test. Continuing on with more diagnosis. An ultrasound and X-ray can bring light to a potentially cancerous issue. CT scans and MRIs as well. When diagnosing cancer, the severity of the tumor is usually graded. These grades are 1, 2, 3, and 4 in Roman numerals. Knowing that the grade of cancer a patient has helps in the treatment planning and treatment result comparisons. See pages 88 and 89 in your text for an in-depth explanation of this. Alright, these stages used in diagnosing cancer uses the TNM classification system to estimate the extent to which the tumor has spread. T refers to the size and extent of the primary tumor. N refers to the number or area of lymph nodes involved, and M refers to the any metastases of the primary tumor. Look again to page 89 in your book for the numerical system used to identify the extent of the disease. Now on treatment. I mentioned in slide 11 about biopsies and tumor removal. These fall into the surgery category. There can be curative surgery done to remove all the cancerous tissue in hopes of curing the patient. Palliative surgery is done to sustain the patient with cancer or alleviate any pain, which would be associated with malignant pain, that directly and indirectly result from the person's cancer. And then there is a preventative surgery. This type of treatment has seen an uptick with advancements in tumor markers being identified in someone's gene pool or blood. Cancer might not yet have set in. However, the patient can decide to take part in preventative surgery to prevent the development of cancer. My example here is the actress Angelina Jolie. Her mother had breast cancer, and she herself tested positive for carrying the BRCA genes associated with breast cancer. So, Angelina Jolie opted to have her breast removed as part of the preventative surgery, drastically reducing her risk for contracting breast cancer. So if cancer still prevails, treatment options lean towards radiation therapy and chemotherapy, even if surgical options didn't intervene. I say and or because there are times when there are complementary treatments plans that try to use a bit of everything. So they might use surgery and chemo and radiation to attack the cancer. A bit more in depth, chemotherapy, chemical, is a chemical agent to stop the growth of cancer cells. With any chemical treatment, there are side effects. Anemia is one of them. This is the reduction below normal concentrations of hemoglobin in the blood, resulting in decreased oxygen carrying capacity of a patient's blood cells. Leukopenia, leuko being the medical prefix for white cell. This is an abnormal decrease in white blood cells. Some other side effects: nausea, vomiting, and anorexia. This anorexia is not to be confused with anorexia nervosa. Anorexia is the term used for not eating due to no appetite. Anorexia nervosa is a psychological disease where a person refuses to eat. We will go over that disease in our psychological chapter later this semester. Confusion can also be a side effect of chemotherapy, along with disorientation and hair loss. Chemotherapy affects several systems because it's pumped into the body via the bloodstream, excuse me, and therefore it's pumped everywhere. As for radiation therapy, it treats similarly to chemotherapy. However, radiation can be applied externally or internally. See page 90 in your text for more details. Radiation can be used alone or in combination with other treatments. More on treatments. Immunotherapy, or biotherapy, stimulates or restores and strengthens a body's own immune system. An example here would be the use of interferons with melanomas. Hormonal therapy is a treatment that aids, blocks, or removes hormones that may be feeding cancer cells. Stem and bone marrow transplants can do wonders. These transplanted cells travel to the bone marrow of the infected patient, where they begin to produce new blood cells, ultimately replacing the cancer cells. Another fantastic advancement in cancer treatment involves nanotechnology. Again, take the time now to watch this link on nanotechnology. These tools are smaller than cancer cells and have taken personalized treatments to an entire new level. Okay, it's our last slide here. I want to talk about the many ways that cancer can be prevented. Several are lifestyle choices that can be made. Refrain from tobacco use, practice sun safety, eat healthy, exercise regularly, get vaccinated like for hepatitis C or HPV, avoid risky behaviors like intravenous drug use and needle sharing, practice self-examinations and screening for every part of your body. Know your family history and practice moderation, because it's been said that everything causes cancer, so if there is something you enjoy, do it in moderation to prevent a potential route to cancer. So that's it. This is it for our cancer lecture. This week is a big one. You guys have a discussion assignment as usual, as well as your first exam that covers chapters 1 through 5. I have created an example of a study guide utilizing your weekly objectives that's posted on Talon. This is the only time that I will do this for you guys. I want it to be helpful to you. Learn to create a guide on your own from your objectives for future exams and quizzes. Your exam must be taken at a testing center, either Iowa City or Cedar Rapids, your choice, unless it's otherwise specified due to some unforeseen incidences due to a meteorite or another pandemic. If you have any other questions, though, do not hesitate to reach out. Best of luck.